Hello everyone. Today is 12th October, the World Arthritis Day, and on this day, to increase the awareness on arthritis in children, I bring the second presentation on the series Arthritis in Children Must Know for Every Pediatrician. And in today's brief talk, I would be talking on three things one must not miss while treating acute arthritis. As previously highlighted, this series of presentation is to strengthen the pediatrician's capability to diagnose and treat arthritis in children. And in this series of presentations, it would be highlighted how pediatricians, in consultation with pediatric rheumatologists, can treat arthritis in children effectively. As previously highlighted, acute arthritis versus chronic arthritis. If the duration is less than 6 weeks, we call it acute, and if it is more than 6 weeks, we call it chronic. And one of the most common causes of chronic arthritis is juvenile idiopathic arthritis. But in today's talk, we would highlight acute arthritis. If a young child, preferably below the age of 5, comes to you with fever, a single joint involved, and looking very sick, it's likely to be septic arthritis. If a febrile child has myalgias, arthralgias, and multiple joints swollen for a very short duration, this is likely viral arthritis. And if a child with arthritis is brought with this typical rash, the palpable purpuric rash over the lower limbs, we all know this is anoxon in purpura, which is now called the IgA vasculitis. So these are the common differential diagnosis in a child with acute arthritis. But what are those three things one must not miss in acute arthritis? Case number 1, a 7-year-old girl presented to us with right knee swelling for the past 15 days. She also had high-grade fever reaching up to 1 or 2 degree Fahrenheit. So we thought this is probably monoarthritis. But then this girl would wake up at night due to pains, which looked very odd for any child with arthritis, waking up in middle of the night with severe pains. And when we looked at her hemogram, there was anemia, there was leukocytosis, and the platelet counts appeared to be slightly reduced. But what is important? Please look at the differential counts. You can clearly see there is marked lymphocytic predominance. In most of the cases of arthritis, whether it is juvenile idiopathic arthritis or any form of arthritis, you would see neutrophilic predominance. The moment you see lymphocytic predominance, this is a red herring. A child with arthritis, night pains, and lymphocytic predominance, this is a case of acute leukemia. So never miss leukemia in a child with acute arthritis, especially if they present with this symptomatology. Second case, a 2-year-old boy presented to us with fever for 7 days, right knee arthritis. We thought this is probably septic arthritis because a single joint was affected. But then this child had this kind of red eyes, conjunctival injection, no discharge, a diffuse maculopapular rash, and there was extremity edema, non-pitting edema of the extremity. The inflammatory parameters were elevated. This child has been diagnosed to have Kawasaki disease. So children with Kawasaki disease can present with acute arthritis and they are at risk of coronary aneurysms. One must diagnose them in time. Third case, a 3-year-old boy comes to us with right knee and ankle being swollen for the past 7 days, and it's quite painful. The child refuses examination. But what was important? The past history. The father said that this child would have occasional bluish spots in the body. When we inquired further, there was occasional bruising and intermittent epistaxis. This history could have easily been missed if not asked for. Arthritis, past history of bleeds, evaluation showed prolonged APTT. This child was diagnosed to have hemophilia, a bleeding disorder that can present with acute arthritis. So the three things one must not miss while treating acute arthritis. If a child has arthritis with night pains, bone pains, think of leukemia. The differential counts may give you a clue. A good peripheral smear examination may give you a clue. Do not miss Kawasaki disease in a child with acute arthritis. Look for systemic symptoms. And if a child with arthritis comes with bleeding tendencies, think about bleeding disorder, think about hemophilia, ask for this history. This history may not always be present and one must meticulously ask for this history and do a detailed exam so that one does not miss these three things in a child with acute arthritis. Thank you.